How does brain imaging diagnose hemorrhagic stroke? Imagine a sudden, severe headache or weakness that comes on quickly. Doctors need to find out what's happening inside the brain fast. Brain imaging plays a crucial role in diagnosing hemorrhagic stroke because it allows us to see if there is bleeding within the brain tissue. The two main tools used are computed tomography scans and magnetic resonance imaging scans. A computed tomography scan, often called a CORT scan, is usually the first test performed when stroke is suspected. It is very quick and highly sensitive to fresh blood. On a CORT scan, blood appears as a bright or hyperdense area because it increases the attenuation values measured in Hounsfield units. This brightness helps doctors identify the exact location and size of the bleed. The scan can also reveal swelling around the brain tissue, known as vasogenic edema, and show if the bleeding is pressing on other parts of the brain, causing a shift of the brain's midline structures. It can detect bleeding extending into the ventricles, which are fluid-filled spaces in the brain, or signs of increased pressure like hydrocephalus or brain herniation. Sometimes, contrast-enhanced CORT or CORT angiography is used to look for abnormal blood vessels, active bleeding spots, or tumors that might have caused the hemorrhage. Because of its speed and accuracy in detecting acute bleeding, CORT is the go-to imaging test in emergency situations involving stroke. Magnetic resonance imaging, or MRI, offers a different set of advantages. It uses strong magnetic fields and radio waves to produce detailed images of the brain. Sequences like gradient echo and susceptibility-weighted imaging are especially good at detecting blood, even small or old hemorrhages. MRI can tell the difference between a primary hemorrhagic stroke and bleeding that occurs after an ischemic stroke, which is caused by a blockage. It is particularly helpful in the subacute phase when the blood may no longer be as visible on a CORT scan, because the hematoma can become isodense, making it harder to see. MRI also helps identify underlying causes such as vascular malformations, tumors, or small vessel diseases like hypertensive microangiopathy or cerebral amyloid angiopathy. After the initial emergency phase, MRI is often used to explore the cause of the bleed and plan further treatment. Additional imaging techniques like magnetic resonance angiography, CORT angiography, or digital subtraction angiography can be used to look for abnormalities in blood vessels, such as aneurysms or arteriovenous malformations, which might have led to the hemorrhage. These tests help assess the risk of the bleed getting worse and guide doctors in deciding whether surgery or other procedures are needed. In summary, brain imaging diagnoses hemorrhagic stroke by showing the presence of bleeding within the brain tissue, pinpointing its size and location, and revealing any complications or underlying causes. CORT scans are the first choice because they are fast and effective at detecting acute bleeding. MRI provides detailed images that are especially useful for understanding the cause of the bleed and in the later stages of recovery. Both tools are essential for guiding treatment decisions, whether that involves medical management or surgical intervention. Always remember, if you or someone else shows signs of a stroke, seek emergency medical help immediately to get the right imaging and care.